Question 1. The nurse is preparing to teach a prenatal class about fetal circulation. Which statements would be included in the teaching plan? Select all that apply. 1. The ductus arteriosus allows blood to bypass the fetal lungs. 2. One vein carries oxygenated blood from the placenta to the fetus. 3. The normal fetal heartbeat range is 160 to 180 beats per minute during pregnancy. 4. Two arteries carry deoxygenated blood and waste products away from the fetus to the placenta. 5. Two veins carry blood that is high in carbon dioxide and other waste products away from the fetus to the placenta. Explanation. Question 1. Rationale. The ductus arteriosus is a unique fetal circulation structure that allows blood to bypass the non-functioning fetal lungs. Oxygenated blood is transported to the fetus by one umbilical vein. The normal fetal heartbeat range is considered to be 110 to 160 beats per minute. Two arteries carry deoxygenated blood and waste products from the fetus, and one umbilical vein carries oxygenated blood and provides oxygen and nutrients to the fetus. Blood pumped by the embryo's heart leaves the embryo through two umbilical arteries. Test-taking strategy. Focus on the subject, fetal circulation. Recall that 3 umbilical vessels are within the umbilical cord, 2 arteries and 1 vein, and that the vein carries oxygenated blood and the arteries carry deoxygenated blood. Also recalling the normal fetal heartbeat will assist in answering correctly.